Well, from time to time, those of you that know that I've dabbled a little bit in talk radio know that I frequently ask the question, what does it take to get the villagers excited enough to grab the pitchforks, grab the torches, and storm the castle? We're so laid back here in San Diego, but we finally know what will do it. It's health care reform, and Congressman Darrell Issa knows all too well. He's got his town hall meeting set up for tonight. How you doing?
I'm doing fine, Mark.
You really want to do this tonight, huh?
I do, and I want to do it for the reasons that I know you can understand. Healthcare is personal, and people are personally concerned. They know there's 1,100 pages. They know it's controversial. They've heard all the bad things that are in it. What they haven't heard is there are a lot of things we can do. Some of them are in the bill, most of them are not, that we should be doing on a bipartisan basis. The president has said to 100 members of his own party in the House, or he's going to say it today, that the single-payer government option is out. That means we can start again looking at driving down the cost of health care while maintaining the historic individual relationship that you have with your doctor, that I have with my doctor, and hopefully we can start giving everyone the opportunity that I have as a member of Congress. You know, federal employees have a good set of choices, over 300 choices of health care programs. They're all private, they're all reasonably affordable, and by the way, they're all portable. If we have a health care situation, cancer or whatever, we can still go from plan to plan, and by the way, our rates don't jump up. These are all the benefits that Congress enjoys, and you're saying, you know, we can spread some of those to the American people, and why not? It would take a one-page bill to give everyone the right to sign on to the same plans we're on and be part of our pool, and as a result have affordable health care. Obviously, this has become such a hot-button issue. It's causing the president fits because he made this a cornerstone of his administration, you know, to get health care reform. How do you cool everything down now and go back to, as you say, a reasonable dialogue about the things that we can do that most Americans can agree on? Well, if you tell Americans that the health care system we have is good but too expensive and doesn't cover everyone, we all agree. You then start saying, how do we cover more, how do we drive down cost, and how do we maintain the level of health care? We can all agree that that's the goal. If you take those things you have in common, you can build a bill from, let's say, the one page that I would like to do to 100 or 150 pages and throw away 1,100 pages of new government programs. You know, Mark, one of the problems, Canada spends 9% of its GDP, or if you will, there's 9 rocks in the knapsack for every dollar. We spend 18. The initial bill was going to take it to 21. The American people said, wait a second, you're going to deal with the high cost of health care by making it higher. The president now has an opportunity to say, let's find ways to drive down cost, drive up availability, get people out of the emergency rooms, which right now have a very inefficient delivery of not necessarily the best health care. We can do that. And hopefully his statement that the single payer or the government option is out is a good start. Get me back to the number of people that are actually uninsured, because, you know, I just went through, you know, a pretty serious health issue. It's my first day back after prostate cancer surgery. I'm going to be fine. I got great medical care, early detection, great surgery, great aftercare. I'm going to be fine. And I thought about this during the time that I was getting my care. I call my doctor, I go see my doctor. My doctor and I work out the treatment. There's no middleman. There's nobody, you know, telling me, well, you know, you got to wait so many weeks and so forth. And I thought, you know, it would be nice if everybody could have at least some level of care close to what I was blessed with in this situation. How many people are we talking about that are truly uninsured by no fault of their own? People who do not have coverage and cannot afford coverage and are not covered by federal programs or state programs that already give them coverage, less than 12 million. Why does the number keep getting inflated up to, you know, upwards of 40 million Americans? Well, one of the challenges is you have a lot of young people who choose not to have health care. They're included in that. You have people, unfortunately, who have made decisions to do other things with their money, even though they could afford it. You have people who are simply between jobs and have chosen not to. And unfortunately, a large amount of that 40-some million are eligible for federal programs, which they may even avail themselves of if they have a health problem, but when they're polled, are you insured today, the answer is no. But having said that, we do have a crisis in America. Emergency rooms are clogged with people who use that as their daily medical care.
We've all seen it. We've gone to urgent care and so forth. And we've seen people in there with, colds, waiting to see a doctor when, folks are seriously ill. I'm going to have to let it go at that and ask folks to come out to your town hall meeting tonight. Tell me again where and what time?
It's at Rancho Buena Vista High School in Vista. It'll be at 6:30. We'll be there for at least an hour and a half. We have capacity both inside and outside. And we're looking forward to a good discussion about what do we do next with the president to solve some of these problems.
I love the idea that there's some reasonable dialogue and some cool heads.
Thank you, Mark.
Thank you so much.
Appreciate
Good
it.
to
Welcome
have you
back.
Here. Yeah, thank you. Thanks for the update. All right, for more information, you go to san diego6.com. Just click on Hot Topics there.